And turning to the latest on the COVID-19 pandemic, South Korea is working to bring in more doses of Pfizer's COVID-19 pill than it initially announced. This comes as South Korea expects a downturn in critical cases from next week. Yeon-seung reports.
Critically ill COVID-19 patients are at record levels, with 1,084 patients in critical condition as of Friday. But on the back of the authorities' efforts to expand the healthcare capacity, the share of occupied ICU beds has dropped in recent days, from 83% to under 79%. Also, health authorities say that with the slowdown in infections, the number of critically ill patients may see a turnaround from next week. This comes as South Korea reported 6,233 new COVID-19 infections on Friday. And the number of deaths was 56, almost half the previous day's tally. Meanwhile, South Korea is working on securing even more of Pfizer's Paxlovid COVID-19 pill.
The government has been working out a deal with Pfizer for enough doses for 300,000 or more people, way more than the 70,000 earlier pledged. We're now in the final stages of that deal, and the Korea Disease Control and Prevention Agency will soon make an announcement.
As for vaccinations, more than 67% of the elderly have received their booster shots. Prime Minister Kim added that as more and more booster shots are being given to these high-risk age groups, infections among those have dropped from 35% to the mid-20% range. But patients who've been infected after getting their full doses of vaccinations may not need top-up shots. Health authorities say they're looking at domestic and overseas studies to determine whether fully vaccinated people who have also caught COVID-19 need booster shots. Currently, boosters are not being recommended for those who have had breakthrough infections, as they may have already developed stronger immunity. Yeon-seung, Arirang News.